Good afternoon. My name is Augusto Solonio, and in this video, I will be discussing the cases of two patients who are undergoing crisis, and of course, I will discuss my approach in managing this patient's crisis. The first patient is a case of a 45-year-old male who has been married for 15 years with two children. This patient has a history of major depressive disorder and pornography addiction. Apparently, this patient has been taking Celexa, and the problem with pornography addiction has been dealt with. This patient is having marital problems or issues with his wife. His wife cheated on him and left him, and the wife brought his kids with her. This patient also endorses having alcohol consumption issues, drinking almost on a daily basis. This patient is also having issues with his employment, and he has been absent from work because of his problem with his wife. So this patient is undergoing divorce proceedings, and this patient is verbalizing having thoughts of suicide with a plan to shoot himself. So the main concern for this patient at present is his active thoughts of suicidal ideation. So my approach for this patient would be, of course, to finish up my comprehensive assessment. I might be using suicide risk assessment tools like the CSSRS. And after finishing my comprehensive assessment, my plan or my treatment plan would include inpatient psychiatric admission. I would convince this patient to be hospitalized in an inpatient psychiatric unit on a voluntary basis in order for his stabilization. So, of course, the goal of my approach is to prioritize the patient's safety, and inpatient hospitalization would benefit this patient. Now, after granting that the patient agreed to be admitted in a psychiatric unit to be stabilized with his suicidal ideation, I would include in the plan for his follow-up visit post hospitalization. Now, in the after hospitalization visit, I will be discussing, or I would suggest to the patient to discuss management of his alcohol consumption issues. Also, I would include medication management. It appears that the Celexa is no longer working for this patient, and to replace or to have a different medication might benefit the patient. I would also include therapy on or in an outpatient basis. Of course, to discuss available support groups for this patient and to support this patient with when it comes to his employment issue, and also legal support or to provide support for his legal problem undergoing for this patient who is undergoing divorce proceedings that would include probably the custody of the kids. So to summarize my approach for this patient, again, the priority is the patient's safety. Considering that this patient is actively suicidal, inpatient psychiatric admission is deemed necessary and would benefit this patient. Of course, I have to eliminate or address the issue of firearm issue. Like if this patient has an access to firearm, that would need to be addressed. And of course, since this patient has been verbalizing suicidal thoughts, it would be deemed necessary for this patient not to be left alone pending his admission to an inpatient psychiatric unit. So that would be my approach for this patient. The second case is involving a 19-year-old female with a 2-month-old baby. This patient has been accompanied by her husband during the visit, and this patient shows inappropriate actions or inappropriate appearance compared to her previous or compared to her baseline. This patient also shows rapid speech, including tangential thoughts, loose associations, and the most concerning is her delusional thoughts about her baby, compromising not only her safety but the safety of the baby. So obviously the patient is in crisis as well. So my approach would be the same with the first patient, which is to address not only the patient's safety but the the safety of her baby. So the approach should be finish my comprehensive assessment, involve the husband with the treatment, and I would strongly suggest that this patient will be admitted in an inpatient psychiatric unit for her stabilization. And if needed, if this patient refused admission, then it might warrant involuntary admission. In this case, I would suggest that the husband will petition for the admission of this patient, and this patient will be certified to be admitted in an inpatient psychiatric unit. So that makes it different from the first case wherein the first patient might agree to be hospitalized, so the admission will be voluntary. The second patient, the admission might be involuntary basis. And of course, the second patient, after hospitalization, I would suggest that follow-up visit will be done as well. And or follow-up visit in order to determine or to have a comprehensive evaluation, a detailed psychiatric evaluation to determine the condition of the patient, whether it involves postpartum psychosis, bipolar disorder, or any other psychiatric disorder. And also, the approach would include family support and education for the husband. And it might also include medication management. So to summarize my approach for the second patient, my approach would be for the involuntary admission of this patient in a psychiatric unit for her stabilization. Thank you.